How much fluid does your surgical patient actually need? Most students guess. Here is how to calculate it. During surgery, IV fluids maintain perfusion to vital organs. The heart, kidney, and brain depend on this. Three goals: replace the preoperative defects, provide maintenance fluids, and replace all ongoing surgical losses. There are two types of IV fluids: crystalloids, which contain salts, and colloids, which contain large molecules. Common crystalloids include normosaline, Ringer's lactate, and dextrose in water. Ringer's lactate is most preferred intraoperatively. Colloids like albumin and hydroxyethyl starch stay in blood vessels longer, used when crystalloids alone are insufficient. The 4-to-1 rule calculates hourly maintenance: 4 for the first 10 kg, 2 for the next 10, and 1 after. A 70 kg patient NPO for 8 hours has an 880 ml defilled before surgery even starts. Third space losses shift fluids into tissues. Minor surgeries need 1 to 2, major surgeries up to 10 ml per kg per hour. Replace blood loss with 3-to-1 ratio using crystalloid or 1-to-1 ratio using colloid or blood. Goal-directed fluid therapy uses stroke volume variations to decide exactly when and how much fluid to give. 70 kg patient, 8 hours NPO, major abdominal surgery, first hour fluid requirement is approximately 1500 milliliters. Monitor fluid status using urine output, blood pressure, heart rate, and capillary refill time throughout the surgery. If this helped, like and subscribe. Comment below. Can you calculate the fluid for a 60 kg patient?